COVID-19 cases in Nagaland continues to surge. Dimapur, Kohima and Peren remains the top 3 districts worst hit by the pandemic. Centre issues detailed guidelines regarding celebration of Independence Day, asks states and union territories not to allow large congregations. And India's COVID-19 tally reached 12.87 lakh. A total of 49,310 cases are registered in a single day. Death toll mounts to 30,601. Well, those were the headlines. Hello and welcome once again to this news broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from the state. A total of 63 persons were confirmed to have contracted coronavirus from the state, with their samples having tested positive of COVID-19 from the 3 worst hit districts of Nagaland. State's Health and Family Welfare Minister S. Pangnipom said in his tweet this morning that the fresh cases were reported from the 372 samples tested. Out of the 63 fresh cases, 41 were reported from Dimapur, 21 in Kohima and 1 in Peren. Meanwhile, in another tweet this evening, the state's Health and Family Welfare Minister tweeted to inform that 2 more positive cases of COVID-19 have been confirmed, 1 each in Twensang and Peren. He also informed in his tweet that another 7 more COVID-19 patients have recovered from Kohima. Dimapur continues to be the worst hit district in terms of the number of positive cases of coronavirus. With 41 more patients added to its tally, the district has so far reported 500 cases, while 163 patients have recovered. Active cases now stand at 334. Meanwhile, Dimapur also reported its first casualty of COVID-19 with the death of a 76-year-old male patient this morning. MS Dimapur Dr. Kheshto informed News and Trends over phone that the deceased, a resident of Kalibari Road, Dimapur, died at COVID hospital at around 8:30 this morning. The MS informed that the patient was tested of the virus through ThruNat and his samples were sent to the BSL-3 lab at NHAK Kohima for confirmatory RT-PCR tests. However, before the confirmatory test results arrived, the patient died. Dr. Kheshto informed that the patient died of old age, congestive cardiac failure and had post-myocardial infarction. He had developed breathlessness since he was brought to the hospital in the wee hours of this morning. The MS further informed that the dead body of the patient has been released from the hospital as being death due to COVID-19. He also informed that the condition of an 82-year-old patient currently on ventilator support at Dimapur COVID Hospital is serious since the patient is diabetic with past history of tuberculosis and pulmonary open heart surgery. Kohima's tally rose to 299 with an addition of 21 cases today. The increasing number of infections have been alarming, and the district task force, which met yesterday, had decided to promulgate total lockdown in its municipality for a period of 1 week beginning from tomorrow. Deputy Commissioner Kohima Gregory Tejawale had informed that the lockdown was initiated to enable the medical team to carry out comprehensive contact tracing to contain the spread of the virus in the community.
Why we are going for a lockdown is we want to enhance our active surveillance activities, and we want to come up with a more comprehensive approach to our contact tracing and early detection of suspected cases and isolation measures. Not exactly to break the chain of the transmission, but to slow down and to curtail to a certain level. We are still running ATI, Merema and Kebaze. So these 3 we are still running. We'll concentrate more in the town because that is our concern. And if you see the cases, as I've said, it's all in the town areas. So we are more concerned about the town, the municipal area. So perhaps we'll go for the municipal area like that.
With an addition of 21 fresh cases, Kohima has now reported 299, out of which 117 have recovered, and active cases stand at 182. Parents' tally of positive cases now stand at 253, with an addition of 2 more cases today. The district is the third worst hit after Dimapur and Kohima. While 193 patients have recovered, active cases now stand at 60, with 1 patient having mild symptoms, while the rest are asymptomatic. Kifri still remained the only district in the state that has not reported any COVID-19 cases so far. And as per the data provided by the Department of Health and Family Welfare, the state's tally of total positive cases now stand at 1,239, with 537 recovered and active cases at 701. 1 person has died of the coronavirus infection from the state. The centre has issued detailed guidelines regarding celebration of Independence Day on 15th August amidst COVID-19. In a letter written to the Chief Secretaries of all the states and union territories, Ministry of Home Affairs MHA has informed that the Independence Day celebrations should be held in a way befitting the occasion. However, in its clear direction to the states, district and panchayat authorities, MHA has instructed not to allow large congregations, keeping in mind mandatory physical distancing norms. It said digital technology should be used to maximize people participation. Following the precautionary steps as suggested by the Home Ministry guidelines, Independence Day celebrations at the Red Fort this year will consist of the Prime Minister's speech, Guard of Honor, unfurling of national flag, national anthem and release of tricolour balloons. The guidelines also suggest inviting COVID warriors such as doctors, health workers, sanitation workers as a recognition of their service in the fight against the pandemic. India saw a record single-day spike of 49,310 COVID-19 cases, taking the country's tally to 12,87,945 today, while the recoveries surged to 8,17,208 according to the Union Health Ministry data. The death toll mounted to 30,601, with 740 new fatalities reported in the span of 24 hours, the data updated at 8 a.m. showed. There are 4,40,135 active cases of coronavirus infections presently in the country. Thus, around 63.45% people have recovered so far. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Delhi, Karnataka, Andhra Pradesh, Uttar Pradesh, Gujarat and West Bengal. In the northeast, Assam has reported 28,791 cases of the pathogen. A total of 3,656 cases have been reported in Tripura, 2,115 in Manipur, Arunachal Pradesh 991, Meghalaya has reported 534 cases, Sikkim has 460 and Mizoram has registered 332 infections so far. The overall number of global COVID-19 cases has increased to over 15.49 million, while the deaths have topped to more than 6.32 lakh according to the Johns Hopkins University. As of this morning, the total number of cases stood at 1,54,95,947, while the fatalities rose to 6,32,918. The US accounted for the world's highest number of infections and fatalities at 40,34,102 and 1,44,242 respectively. Brazil came in the second place with 22,87,475 infections and 84,082 deaths. Now back home, in an effort to help the daughters, sisters, working ladies, the Dimapur District Administration, under the initiative of Deputy Commissioner Anup Kimchi, in collaboration with an NGO by the name of Community Health Initiative, launched the Menstrual Hygiene Management Program MHMP in government schools and colleges at Dimapur Government College today. The Deputy Commissioner, along with Principal DGC Dr. Moanochit Longchar, officially launched the sanitary napkin machine and incinerator for Dimapur College. In his inaugural address, Anup Kimchi announced that through MHMP, sanitary napkin machine and incinerator would be installed in all the government colleges and schools, which would be funded by the Dimapur District Administration. He said this will go a long way in helping the girl child of our society. While expressing concern about health issue with regard to females, the DC said that menstrual hygiene management was a natural biological process and felt that it needs discussion and understanding, including the male members of the society, for resolving the issues. DC Dimapur, while mentioning MHMP as an important component of Bharat mission, emphasized on the need for creating more awareness and training programs in which he felt that NGOs have to play an important role. He advised the CHI for working cost-effective economic model so that the program can cover more institutions. Dr. Rondemo Kikon from CHI, while talking about the health challenges in Nagaland, pointed out isolated geography, poor infrastructure, lack of skilled healthcare, low percent of hospitals, health centers, low percent mother and child healthcare, low vaccine coverage in children as some of the challenges. Kikon also shared that the main focus of the NGO was primary healthcare service, water sanitation and health hygiene promotion, nutrition and livelihood. Director CHI's Lorini Sophia, while highlighting on the MHMP, informed that menstruation taboos stigma was still existent in India. She informed that there are 355 million menstruating women in India, out of which 23 million women drops out of school annually due to the lack of menstrual hygiene and management. She cited lack of sanitary napkins, lack of functional toilets and low awareness on menstruation as the main reasons for early school dropouts. Lorini also informed that besides Dimapur Government College, the Dimapur District Administration, in collaboration with CHI, will be extending the MHMP program to Langrijan Government High School, Nagarjan Government Higher Secondary School, Nepali Khashiram Sarpare Government High School and Deputy Commissioner Dimapur Office. Principal DGC termed the day as momentous and welcome step for the female students numbering around 800 of Dimapur Government College. They expressed gratitude to the DC Dimapur for donating the machines generously and opined that it would be an eye-opener for the other schools and colleges. Out of the 15 government colleges in Nagaland, DGC would be the first college with the facility, he informed. Assistant Professor Mary Penny Muli chaired the program, while Assistant Professor DGC Moamongla Iyer proposed the vote of thanks. Deputy Commissioner Dimapur Anup Kimchi has informed that as per the decision of the District Task Force Dimapur during its emergency meeting today, the additional lockdown measures in Dimapur district will be enforced with effect from 26 July till 2nd August 2020. The lockdown measures are imposed in order to enhance active surveillance and to ensure comprehensive contact tracing, detection of suspect cases and implementation of isolation measures so that the chain of transmission can be slowed down and to contain the spread of COVID-19 infection. The Deputy Commissioner informed that the following are to be strictly observed during the lockdown period. All categories of shops to remain closed except pharmacies. All public movement is prohibited except medical emergencies. Movements of all types of vehicles are prohibited except for medical emergencies. And with that, we come to the end of this broadcast. Do subscribe to us on our YouTube channel and also follow us on Facebook as well. And stay updated with the latest from across the world, the country, the region, and from the state as well. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.